Shall I put the PowerPoint?
Okay, everyone, welcome to Webinar Wednesday. I'm Pebbles Turbyville. I'm the Executive Director of Horses and Humans Research Foundation, and I am going to toss it to Tara Mahoney, who's going to be our host for tonight or today.
Well, welcome to Webinar Wednesday, everybody. We're so glad that you've joined us. My name's Tara Mahoney. I have the honor of serving on the board of Horses and Humans Research Foundation and as co-chair of the Education Committee. You are absolutely in for a treat today. We are here with Anita coming and joining us from Israel. So welcome, Anita, and please go ahead, put up your slides and introduce yourself.
Okay, so thank you very much, everybody, for joining me today. My idea was to look at post-trauma in a slightly different way, in a way that would perhaps be more useful to us working. I know most of you in the audience know about PTSD and chronic PTSD, but I hope that when we get to the end of this PowerPoint that you'll have some new ideas. PTSD, or as you call it, PTS in the States, has become an expression that is used very commonly. And in fact, it's helped many people who are suffering from trauma for all sorts of circumstances. Maybe they've been abused, maybe sexually abused, but it was started off really thanks, or unfortunately, through the American soldiers fighting in the Middle East. So PTSD, most of us, or PTS that we talk about, is a chronic state, but there's a lot of things that happen before that. So we're going to look at it a little differently, and we're going to look and see what it's like to be a good practitioner in this field, and to see whether we're doing the right thing. And then I will talk about some therapy sessions, and we generally reflect on the work. So the first slide is the sequence of a traumatic event. Before we have a traumatic event, we're generally quite happy, everything's okay. And then something dramatic happens. And obviously we can, in its immediate thought, is what happened with a massacre. But when we have a traumatic event, what happens to us is that we fall down. And I would like you to notice in this diagram, there's a V. This is the vortex of the trauma. We fall into it, and we are in a very bad state. So then we need immediate care to pull us out of that. And it can be all the health services, medical services, fire brigade, rescue teams, if you were, in the army, all sorts of different things that can pull you up out of that vortex and give you immediate care. And then you go along after you've come out of the immediate care, and you may need further treatment, further care, and that comes into community care. And all the different types of therapies, people, social workers, occupational therapists, physios, everybody can have a go at helping in community care. And equine assisted services fits in very well in community care. And then our final aim out of this sequence of the trauma is that we hope that somebody's gone through this care and they come out the other end with resilience and maybe post-traumatic growth. So we hope that we've helped the person to come out the other end. Now, how do the body react to trauma? This is a natural thing. It's a normal thing that happens. So we have, first of all, our conscious mind. We see something, we do something, we hear something, something happens, but it's a spark from the conscious mind. And then from the conscious mind, we set up a response in the subconscious mind, or even some people call it the unconscious mind. And in the subconscious mind, we can set up the flight, fight, and freeze response, beginning from the amygdala. We also set up a response, and this is quite complicated, this picture on this side, but we set up a response through our autonomic nervous system. And this sends messages to our whole body, all the different parts of our body. Now, I just want to make this clear for you, because I hear this very often. We talk about the sympathetic autonomic nervous system sets up the flight and fight system, and the parasympathetic sets up the relaxation system. Well, in actual fact, in the parasympathetic autonomic nervous system, the freeze reaction, the freeze response occurs. And you can see it if you have these slides or something later, you can see the different parts of the body, but where along the spinal cord where it comes from. But all of this is, we're put into survival mode. And survival mode, what does that mean? First of all, I want you to think really clearly that this is a normal physical, it's a normal response from the brain to the body. And what happens from the amygdala, and if you can look at my little arrow thing, it sends out these messages through the hypothalamus, it's sending messages out and releasing hormones. And what does that all do to our body? Our body is that, wow, it's a bit like the horse response. We get better vision, we get better hearing, we can change the mouth, we can be dry in the mouth, we can feel even a bit lightheaded, dizzy, our thoughts are racing. The executive function part of the brain is not functioning very well. It's not sending out proper plans. It's all a bit dizzy, but that doesn't matter. The automatic response, the flight and fight mechanism, is preparing the body to protect it. So you can see all the things that it does there, and it tenses muscles, and it changes everything. Now, when a person has a severe trauma, what can happen is that response gets stuck, and it's like it goes round and round and round. And as it gets stuck, it's responding as if all the time to perceived events. So I want you to think of the people you know and how they are stuck. And this system is working, and this is your survival mode. Now, in that survival mode, and when you are stuck and everything's going round and round, you can look at a piece of wood, a stick of wood, and you may think it's a snake. And obviously, if there's other situations in your life, you can look at a person and you can believe that they're a predator. Think of your sexually abused woman who has been raped. She's been raped. She's afraid to go out on the street because she looks at every other guy on the street as a predator. So she's stuck there. So maybe that's my explanation for you. Now, I'm not going into a lot of detail about PTSD, and you guys will know this list very well. But I want to, you see these from these slides of the brain, from the MRIs. This is what happens in PTSD when it, or PTS as you call it, when it becomes chronic. Look how it affects everywhere. This is really quite frightening to see this, but that's another lecture. But I come to this slide, and I put this slide in, and I've added on the website a very good lecture, it's free, on the website about moral injury. Because the people that are traumatized and who are stuck, the people who have PTS or PTSD, PTS, one thing, and it's pretty bad, but moral injury, it's even worse in a way, because you feel guilty, you feel shame, you really alienate yourself. It's very difficult to come out of moral injury. And unfortunately, if you think about our soldiers, you know, they're very young when they go into the army, and things happen. Maybe, you know, if we can think of Iraq and Afghanistan, and they could have been fighting there, and for some reason somebody was killed, that they felt at the time it was really hard that they were killed, but as they get older, they change. Maybe they get to the age of 40, and strong feelings of guilt and shame come. They're trying to deal with moral injury. So I've added on the website a very, very good lecture. Lots of PowerPoint pictures for you, but about this, and to see there's an overlap, but they are different things. And of course, moral injury is very similar to all the people who have gone through sexual trauma and non-accidental injuries. And this funny word here, anhedonia, is that people can't feel things, they can't bring themselves to feel things again. So the trauma that we have, people have, it can start at different points. Now, if you remember this first slide of the sequence of trauma, the person falls into the V. So there, we'll go with this blue line. The person falls in the V, they come out, they're rescued, and they get better. And they don't have any real side effects. The memory can be stored and it's okay. There's others who they go up and down, their moods change, and it goes on for years. There is a difference between men and women, and they say that in the later years, if a man's been traumatized as he gets older, he's able to handle it better than women. I don't know, this is from the British Medical Journal, and I'm not sure about, I mean, I don't have the experience of knowing in the older years. I think that could be discussed. But if you look on this bottom line, not everybody has, feels the effect of the event, the trauma, immediately. Some people, they feel it many years later, 26 years later, and some it comes on slowly. Others, Others, as I say, can heal in no time. Or if it becomes chronic, it doesn't heal very quickly. Just to say here, the normal response back at the beginning, like the response to trauma, you normally feel better in 20 to 30 minutes. So people who have this very powerful trauma and it lasts months, it's a very different thing. So then how can we help? And I've used this American equine assisted services. I'm trying to be good with the United States. I have to get used to all these changes. And how can we help? Well, actually, in the situation we're in here in Israel, we could even be involved in immediate intervention. Now, immediate intervention doesn't mean pulling the person out of the hole straight away, but we could be in the early stages or the mid stages of somebody who has been traumatized. And we can bring them to horses quite early. This is the wonderful thing about horses, because they're so connected to nature. They're outside, and everybody here knows all the good things about what a horse can do for you. So we can get involved in earlier intervention. We certainly can help a person build resilience, and we can treat them, and we can teach a person a skill. We can teach them, train them to work with horses, and we can heal, and we can do help with post-traumatic growth. Now, I picked out the resilience and post-traumatic growth because I think I want you to understand they're not the same thing. The post, sorry, somebody's phoning me. No, go on. For resilience, when somebody comes to the horses, sorry, I have to take these out. Somebody's phoning me. When we're going to build resilience, we need to put a person through a process, and we want to help them to adapt to their situation, adapt to the trauma, and give them some strength to withstand what's happened to them, and give them a feeling that they can bounce back and grow despite life's downturns. It's not easy to help somebody do this, and of course it depends on the person's personality. Everybody is different. That if somebody is outward going, naturally it will be easier to take them through the process of resilience. But if we want them to experience post-traumatic growth, and some of my veterans that I've worked with over the years have actually achieved this in different ways. We want them to move from what was into what can be. And we've got to take them from this world where they feel trapped with the trauma and they're filled with stress and blame. And we want them to feel that they, what happened to them, they're going to find a new worldview. They're going to change their worldview. Now, changing your worldview is not resilience. We're going to give everybody resilience. We're going to try and build them up and make them stronger, manage their traumas. We want to do that. But if we can change their worldview, now, of course, the one that is easiest for you to understand, but I'm not saying this is the answer, but somebody who was not religious suddenly finds solace in religion, whatever the religion, and they take to religious belief, and they've changed their worldview. For many of the veterans I've had who've been very aggressive and angry, they've been able to become soft, caring people and have gone out and helped others. So they changed their worldview. Their worldview before was not to help anybody else, but suddenly they became a different person. And my extreme example of this was not actually somebody with post-trauma, but somebody I saw who was a prisoner for 10 years for, it was for like a murder. And he changed by coming to the therapeutic riding center and working with children with severe disabilities. He completely changed. And when he finally left prison, he took that as his work. He spent the rest of his life volunteering, helping others. So I've taken extremes, but that you want to try to help people to change their worldview as well. And that when they do that, and when it's really rewarding to see that. All right, so I started off by talking about what happened, the flight and fright mechanism and how it affects the body. How are we going to help people with the horses is that we must work from the body back up to the brain. And we can do that with our horses. And we actually can do it faster than people can do it in clinical situations. The horse is fantastic for this. So we are going to use this bottom-up approach. We go, because the body was so traumatized, the blood pressure went up, the eyes became dilated, the hearing went up, the kidneys weren't working well, the muscles got tight, pain, everything was happening to that person's body. And when they have PTS staying with them and they are remain in what I would call this survival mode, they're stuck with all those symptoms, all those manifestations of the trauma affecting their body. So we want to work through the body. And we're going to work in what I call this isn't in particular order, but a two-step process, which means that we must stay in the present. We, not just our horse, that means we must be with them, because we cannot do this half-heartedly. We have to be there with them. And we have to give the person a new experience so they can learn from that new experience. We have to be mindful. When you are in a stuck state, you're not mindful, you're not focused, and you can't be mindful if all your body is overworking. So we have to help somebody to be mindful, and we have to help them to be able to process the trauma and relieve the trauma. And we have to present them with strategies and improve their focus and engagement. And we have to change avoidance. Now, this is a key word for our work. We have to change avoidance to embracement, because avoidance, I've seen this too often in the riding centers. They bring veterans to the center and they ride, but they are still fully in avoidance. They're not changing at all. So we need to remember that word, and we're going to talk about it in a minute. Build resilience. I've said about post-traumatic growth, and we're going to help people to train. So on this, I'm not going to talk about the horse picture, what I've written about the horse, because most of you know this. But there's 5 key things that we can do with the horse to change a person from that survival mode that's going on and on and on. It's running round like a clock. We've got to build attachment, and we can do that really easy with a horse. Attachment is very important. People, when they lose attachment, they lose trust. Key words to you, but attachment is important. So we're going to work on attachment. We're going to work on communication, commitment, and concentration, and body awareness, coordination, and rhythm. Those are all the vital things. So now, this is the 1 to 5, each one separately. And this was what's going to release us from survival mode. So if we can attach through human-horse bonding, and you can see the picture, and we all know it well. If we attach ourselves to a horse, that's it. We love the horse, things happen, and people tell you things happen. But it's vital that we do this. We have to, as practitioners, work at helping somebody bond to their horse, attach to the horse, because it will prevent the avoidance. It will prevent detachment. When you have somebody who comes to the horse and you're wanting to attach them, and they're looking away, or they say they're dizzy, or they have a headache that day, they're detaching. They're avoiding. They're avoiding in that thing. You haven't got them. So you really have to put your focus in and concentrate that you get that attachment. We don't want them detached. And in the worst cases, people will disassociate, and children will do this, especially who have been sexually abused. They will disassociate. They will become like another person. They might even be several people, and you might be treating the wrong person, if you can imagine what I'm trying to say, inside the mind. I listened to a little, somebody who was tortured, a 9-year-old who was tortured for a solid year. And he said he survived the torture. He can't remember it. He detached himself. He disassociated himself. So he was being tortured in one body, and he was saving himself by mentally being somewhere else or being somebody else. And we can do that. The human mind can do that. So I just brought that up because, make sure that you're treating the person who has the trauma and not the detached person or disassociated person. And once you have attachment, people can, they change the feelings of guilt and anger and shame. And you're dealing with, when somebody's not attached, it's logic, they're not in control. So attachment is first thing. Second thing is that communication. And we know that the horse communicates really well with a human being. The horse will tell you, you're in my space, move out my space. I've got a tickly tummy. Don't brush my tummy like that because I don't like it. The horse is in the present and communicating. We have to be as good as the horse. So we have to make sure that we're wide awake and we are sending a clear message and a correct message, and a complete message. Now, you can think about the word complete. And for the person that you're treating, if they get a complete message and they can do something well, they've accomplished. You can build on that completeness. You have to be complete. They have to be complete. Everything has to be clear, and you'll find that it becomes easy for the person and respectful. Now we also, this is like number 3, I think, we want the person to focus, but more than focus. Many people who say, oh, I looked at something, I focused on it. Well, that's not enough. We want it to be extended to concentration and directing attention. We have to be with our client who has been traumatized. We have to be with them, that we can get them to concentrate on the horse and the surroundings. Now, when you start concentrating on the horse environment, you're reworking the cognitive processes. And this will start to help the higher centers of the brain, which I said had gone a little bit deregulated and sleepy because the flight and fight mechanism was so busy. The top bit wasn't working too well. I told you this is a different way of looking at PTSD. We want to open those up and get them working again, get the cognitive processes again. We have to build trust. We have to give a structure to our lesson, and we have to give a purpose. I won't forget when being with Peebles and Tara in France, there was one veteran there who very clearly said he had a purpose again. Purpose for him was very, very important. So we need to give people structure and purpose, and we have to be with them. We have to be in the present with them as we do it, and goals and achievements. But this is the focus and the concentration is connected to that. And then this last one, I think it's the last one, our body awareness. When you are stuck, stressed, and as everybody knows, the DSM diagnosis for PTS, we can be emotionally numb. We're not functioning properly. We're in the survival mode. We are not functioning properly, and our body is not functioning well. Our body, because we're in the survival mode, may have all sorts of aches and pains and different things happening to it. The minute you start giving people jobs and things, caring for a horse, doing things with a horse, the blood pressure comes down, the person changes, and the survival mode is changed. I'm going to go back onto that. We'll come to it in a second. Now, I just wanted to say a few things about the actual practitioner themselves. When you're doing this job, most of you probably sitting in front of this screen are highly qualified, fantastic at your jobs, done millions of things, and your brains are full, and you're probably quite experts in this field. But with it, with all your knowledge, you carry biases, and sometimes you're not really looking at the person in front of you, especially if you use the term PTS. You know, it's a label. You'll have all sorts. Oh, well, he's got inclusion problems. He's got this problem, that. But are you looking at the person in front of you? Are you listening to what they're saying? Are you paying attention to what they do and what they're saying? Now, when I say what do they do, and I actually watch people's bodies. Like you can watch a horse, you can see if they grip their hands tight, or you can see the muscles in their arms move. You can actually look at people and you see what's happening. Did they fidget with their feet? Did they look down? Did they look to a side angle? You've got to be able to really observe your person, and then you've got to hear what the person is saying. And sometimes in the biases, you think you're hearing what they're saying because you're saying, oh, I know all that. I'm exaggerating, but I'm slowing down your thought. Oh, yes, I know what he's saying. Yes, 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 yes. He can't bear the smell of the barbecue or this. But did he say that? Did he really say that to you? You have to listen carefully. And this requires you to have motivation. Are you motivated to listen? A good friend of mine the other day, I read this page to her, and she's a social worker, and she started to giggle. And she said, oh dear, I think I've lost my motivation to do my job. You know, have we still got the motivation to really listen to another person? Or do we create conflict because we misinterpret what they've said? How many people have you heard maybe come to you and say, oh, they didn't, I spoke to so-and-so and they didn't understand what I said. Or I went to this psychologist and I don't want to stay with him because he doesn't listen to me. People need to be listened to and really listened to. If you keep interrupting them as they're talking, you have to be careful because you're breaking the connection. You're not hearing them, and you're, as I put here, you're composing responses. All this leads to a closed mind. And this person, Casement, it's from a book about being a good therapist. He said experienced therapists or analysts have to make an effort to preserve and adequate a state of not knowing. So in other words, you've got to open your mind, leave it open, leave a space for yourself so you can be fresh and understand the person. Okay, and then the last one is about defensive speech. All right, so we have, when somebody has a trauma, if you imagine that they have fallen into a V, they've fallen down in the trauma. And what we want to do is give them a window of tolerance. We want them to find a space where they can start to get well. Well, at this point, I want to just go back and say something that I talked at the beginning about trauma, the sequence of trauma, and I told you how it affects the person's body. Many of the people that you will see, and I know in the States you see a lot of chronic PTS. You're seeing lots of veterans, probably hundreds of them, coming to the horses. But the event, the trauma happened maybe years ago. It may be a few months ago, but generally it could be a long time ago. And the event was finished. You are seeing the person post-event, after the event, and you are treating the person you see now, that person. So you're seeing the person who they've got aches and pains or low focus or avoidance or something, but it's that person who comes to, it's the now person. how can I explain this? Okay, I take it personally. I lost a son 30 years ago in the army. Traumatic event. I'm 30 years on. How is that affecting me now? How am I now? That is the person you are seeing in the arena, the now person. And you have to treat the problems they have now, which can be huge or little, but it's the now person. So you're going to, some people will talk about the trauma to you, and they can talk to you about it, but then you want to find out, well, how do you feel now? How do you feel about it now? And whatever they tell you in the now, you can start to work on them to lift them from maybe pain, maybe emotional blocks, stuck, whatever it is, but you treat them at what they have at that point in time. And groundwork is great for this, because you can bring somebody to the horse, they can go through all these connections, and you can start to put them in the window of tolerance. Now, when somebody is stuck, and they're not making progress, they're emotionally stuck, and their body is stuck and they're emotionally stuck, and the emotions connected to the body are stuck. What you need to do is rebuild this. So you have this wonderful natural environment, and you have the horse, and you can start rebuilding sensory integration. Give them, look around, look at the horse, look at what's happening, and people will take in everything about you. Want to help them to do this. Take in the environment and build up their sensory, what they see. I told it's like it's going from being emotionally blocked to emotional diversity. Nature has diversity. Nature's got everything around us. And if you're in a country where you've got grass and trees and all sorts of lovely things, you have it. So there you have the person in the horse environment. Work on it. As I'm talking to you now, just look around your rooms. Look at the picture, look at the floor, look at the ceiling. Sensory input. Use your sensory input. Connect to the environment, and you'll give them that window of tolerance. You will start to help heal the person. Okay. And of course, keep it safe.
Yeah, I just want to make sure you know the time. We have about 8 to 10 minutes left. I know we started a little late, but
okay, I'll fly through the next bit. Sorry.
Okay, great. No, I just wanted to give you the time.
Yeah.
This is so fascinating. Taking
all right, so we are on the last rundown. So now, this was an example of just standing with a horse in an arena, and I was standing next to this horse, and the people looking over the fence, they hadn't even touched the horse. This is how they started to react. And they said, looking at the horse, they suddenly felt protected. I feel part of the herd. I feel that they felt at home. They felt I exist for somebody. And at the same time, their body was changing. They were reducing their blood pressure. They're reducing the stress. They were feeling calm and feeling relaxed and happy. So this was the change from the trauma vortex into the window of tolerance. Another method is, which you all know is to do good deep breathing exercises. And you can do this riding, or you can do this while you're walking with the horse. Channel the person's thoughts to be present with the horse. And as I said, experience the environment and senses, but don't let them talk about what if, what, you know, they're thinking back to the past, what happened, what you want them boink in the present. So I've rushed through that a bit, but I'm sure you can all practice deep breathing exercises. And when I say deep breathing, you know, don't do it 3 times, do it 20, 30 times, really make people do it. And then tell them, you know, when you get up in the morning, do your breathing exercises, have a good deep breath, and it helps. Another way is also, and the kids, I'm sure many of you have done this with children, is that you could actually be sitting on a horse and you just move about, let it all move. It's like dancing on top of the horse. You obviously need a leader. Maybe, I don't know if you'd even need a sidewalker, but it's like spontaneous movements, and this releases stress. Spontaneous, let it all go. And the term, let it go. So if somebody says to you, oh, I have, you know, always have a pain in my neck from a headache, let it go down through the arms, let it go out through the fingers, shake the fingers, let everything happen, shake the feet, let the pain, let the trauma, let everything go out of your body, let it go. And some people like imagery, you know, they like to feel that they are somebody else on top of the horse. So maybe if they say something to you, oh, I imagine I don't know what at this point, but they imagine, let them imagine, but let it go. That's really important. Now, some people need to feel a sense of control, and this is slightly different. If somebody was in the clinic and they wanted to do some calming therapy, you'd say to them, well, sit with your back against the chair, press your back into the chair, feel strong, feel the chair is protecting you. So on top of a horse, you can sit on top of the horse. You can close your hands on the reins. You can press your feet on the stirrup irons, and you can feel the saddle. You can sit down on the saddle and you can feel strong. You feel the sense of security. And even when you can get walking in a 3-dimensional movement, the rhythm, the moving makes you feel stronger. Now, if you're doing groundwork, walking beside the horse and brushing and cleaning the horse is also a very strong, a sense of control, being strong again. And then this one, I don't know if you know this, but in Israel, people who've tried to commit suicide and they end up in the hospital, part of the treatment is to put a lot of they're special heavy blankets on top of the person so they feel loved and hugged. And you can do the same thing with your horse. You can take off all the equipment, I mean, make it as safe as possible, but hugging the horse, lying across the horse, getting really close to something that's big and pushing onto your chest will make the person feel really good. So I kind of speeded up. There you are, folks. We did it. I had no idea at the time either.
You were amazing. I know you were worried about getting over, but we even started late. I mean, Anita, it's just amazing to hear how you progress through all of the different processes and reinforce and validate, like you said, what a lot of the experts are doing, but at the same time, just the way you describe it. We'd love to open it up to some questions. If you have any thoughts, please jump into the chat. We saw some of the comments in there with Suzanne Hazeman, an absolutely talented therapist who we have the honor of working with a ton. and learning from. So really good point that the therapeutic alliance is between the horse and the client, as well as between the facilitator or the therapist. So that's a really good
Right.
point. Working in a
Yes.
triad rather than just that, one-on-one. And the idea is mostly for us to get out of the way, correct? And let the horse become the agent of change.
Yeah, I agree with you, and we have to learn to say less.
Right.
But what we say should be, really clear and meaningful. And this is difficult. It's very difficult to be like this. And please look at the person who is in front of you, and that is who you're working with.
Mm. Very good point, right? So it is that person, me yesterday was different than me today. And we can even say that relatable rather than pre or post trauma or any of that. So certainly, we look for things like anniversaries or what types of things might, put that person in some place of change throughout the year. But it was really interesting how you did the weave, right? I'm sure a
Yes.
lot of people here experience that. Could you say a little bit about empowerment? We say the word resilience a lot, right? Resilience is in the moment dealing with a difficult situation and being able to come out on the other side. But we're hearing a lot about empowerment, where empowerment is even before resilience, because you've been empowered to either have a voice or not get necessarily into those difficult situations as much.
Yeah, I'm just putting my hearing aid back in. So
Okay.
you have to be tolerant.
Even let anyone else ask some questions.
Okay, yeah.
We're not putting it into the chat
Look,
here.
it's very the empowering thing. I think one of the is that you learn. First of all, you learn this new skill. I didn't talk too much about, but as the person learns even to wash and clean and care for a horse, this is a new skill, and it's being able to support another living being is empowering again at the very basic level. So as depending on the activities, I mean, you work with all these wonderful round pens and things, and you can make a person feel incredibly strong if he's in the middle of the round pen and he's working with his horse.
Right.
Has a million other things, but it's empowerment should go along, and it's like connected with achievement, empowerment. As you achieve and you feel more in control. Now, even taking at a more simple, if you just work on the ground, that the person, I mean, we all notice the person when they first come with the horse, it's very difficult for them and they don't know what to do. And then over a few weeks, they learn to lead a horse and to take care of a horse. And that is empowering. And it's another subject, but we can also put back a person's role within the family, that they become the supporter and leader and comforter again. And then we can put that back into their family life. So there's a lot of things that can come with empowerment. It's also important.
Well, it sounds like we need to have another webinar with you, Anita. You are absolutely incredible.
No, I've squashed this all in. We squashed it.
No. We're just gonna start having our Tuesdays.
I didn't want to just talk about the DSM list, because you guys all know that. You all know this, and I just want to say that when you go, if we want to do best practice, and we do have our partner is the horse. And the horse does best practice. The horse never, in my eyes, the horse never makes a mistake. It's us who make the mistakes, and we lose concentration and we don't stick at it. And the other thing is not to forget, we think we're so clever and we know it all. So we sometimes have to just say, give it a space. No, we don't. We don't know what this person really wants. What do they really want? We need to think about that specific person. And find out about
When we were
them.
in France, you had one really just closing point was bring the fun back in, right? We talk about fight, flight, freeze. We talk about flock or fawn, all
Yeah.
these different ones. But when you and I were talking is bring the fun back, right? So we just
Yes,
bring in the
yes.
silliness and bring in the joy and all of that. But, Anita, we're at time and just respects everyone's
Yes,
you
yes,
joined us in the
sorry.
middle of the afternoon. It's absolutely wonderful. Please, guys, have any feedback, Anita? If we
Yes,
can, you have such a wealth of information, and we can get people, if they'd like to have these slides or your contact for sure.
yeah. I
Anita,
just want to say, I'd say one more thing. I put up the moral injury lecture. I'll put up a couple more really interesting lectures. I went to these lectures; they were really fantastic, and they'll be there if anybody wants to read. They're more like PowerPoint lectures. They're really good. So
Thank you so much.
yeah, so
We love
they'll be there for you.
resources. That's what
Yes.
HHRF is
That's it.
all about.
And
Just
Anita, I did have one question about a citation. The Brian et al. In 2017 on moral injury. Do you have more? Where is that citation?
Oh, here, just a second. Don't go away, because I put it on the. Wait a minute.
just to circle back to moral injury, if
Now, I
anyone
just want to look. I just get you 1 second. How do I get out of this shared? Wait a minute.
Well, let's
Wait.
just circle back on the definition of moral injury. The Syracuse Project is a very good resource on the moral injury project with Syracuse University. But again, moral injury is 3 factors.
Here you are. Wait a minute.
Perpetrated.
Wait a minute. I just going up.
Got it.
No, you can't. Wait. I'm not being clever. Hang on a second. Wait. What? No, wait. Wait.
Why don't we do this? Everybody that's been on the webinar, look for it. We will have it posted and this follow-up, how about on our Facebook? We'll get it from her and we will absolutely put it on our Facebook and send you the
Yes, and it's yes, it's here. Oh, wait a minute.
Okay, let's let everyone go. Thank you guys.
It's by Dr. Anne Harwood Gross. She works in Israel now. But it's a really good lecture, and it's just about it's military, it's trauma, but it's really moral injury. So yeah. Have you gone?
Nope, we're still here. Thank you all so much.
I will send this to Peoples as well.
Okay. That's great.
I'm sorry.
Thank you.
All right.
I'm
Thank
sorry.
you.
I will send it. Yes. I just think it's a good one. And I get a lot of these lectures and I go to them, and I will put up some more for, because we all, it's useful for us all.
It is, right?
That's it. So that's good. So I hope you all enjoy yourself with your horses and have fun. That's it. And stay safe, everybody. Stay safe.
For sure. You're certainly in our
Okay.
Okay,
Bye.
we're going to have everybody else jump off. Anita, if you want to stay on for another minute with Pebbles and I. But thank you so much. So grateful. Always learn so much from you.
Okay. All
Everyone
right.
check out the HHRF conference in San Diego coming up in February for sure.
Thank you.
Okay.